Local congressmen and women are weighing in on how this is going to affect our country short-term and long-term. Fox Toledo's Sean Haggerty's been talking to them today, and I understand their takes are very different.
Yeah, just as partisan as the vote was yesterday, you're starting to see that in party lines tonight as the reaction comes in. Congressman Bob Latta, who did not support the plan, says he's really worried about the trillions of dollars in debt this country could be in because of this bill. Congresswoman Marcy Kaptur, though, is looking a little more optimistically at the whole thing. Kaptur says in the short term, parents can keep kids on their plans until they're 26 years old. Seniors will be getting payments to make up for the holes in their prescription plans, and people with pre-existing conditions can go into a temporary program to get coverage. And she says even more benefits will be coming over time, especially for small businesses.
What we hope to do is we hope to be able to provide plans that are robust enough that they could look at and say, hey, wait a minute, if there are affordability credits that would accrue because my employees aren't paid that much, that my business could actually benefit by getting insured.
Congresswoman Marcy Kaptur says creating large pools of insurance will help over 12,000 local small businesses to afford insurance, but it will take time. And as for funding the entire bill
that came back to us from the Senate only takes very high income earners and asks them to pay more into the Treasury.
We could have done these things one by one, not doing it all in this one massive piece of legislation.
Congressman Bob Latta says the whole process was done in bad faith.
It's pretty bad when you have to have members of Congress getting massive goodies to say they're going to vote for the most important piece of legislation we might have seen in 75 to 80 years.
Kaptur, though, says the whole thing will benefit not only the uninsured, but those already getting coverage.
If they appreciate the insurance they have now and they feel it's priced well and they get what they want, fine, they can keep it, but it gives them a chance to look at other options.
Kaptur adds that businesses with under 50 employees will get a 35% tax credit on premiums if they offer coverage. That is expected to increase to 50%, but that won't be until 2014. Reporting live, Sean Haggerty, Fox Toledo News.
There are so many unanswered questions about what's going to happen with this health care overhaul. We may not know for months because these changes take time. Allison Brown sat down with one doctor to get his perspective on the reform.
We are here with Dr. Jeff Gold at UTMC. Thank you so much for talking with us tonight. Obviously a big day with health care reform. Can you talk to me a little bit about your thoughts on this?
Well, it's certainly been a tumultuous year, or almost 2 years now, since people started to talk about making a major change in the way health care is delivered in the United States. When we started off about a year ago, we were really talking about major health system reform in the United States, which would include not only issues of access and cost, but also firmly addressing issues of standards of quality and the future of the health care workforce. Over time, this discussion has become progressively narrower. Till now, it's focused predominantly on access and on cost.
How do you think this will affect the average citizen?
Well, I think early on, it's just going to cause people to start to ask some questions as to how satisfied they are with their health care and what other opportunities that might arise for them in the future. I think there's going to be almost no immediate ramifications of this. I know people across the country, myself and my family as well, are asking the questions, what does this mean to us tomorrow and next week and next month? And the answer is probably very little. But I think over time, hopefully, it will have some positive impact. There's no question that the cost of health care in the United States, even today as we sit here, is very, very high. It's more than twice as high as the next westernized country in the United States per capita and as a fraction of the gross domestic product. But if you look at the rate it's been rising over the last decades and project that out over the future, one has to not look simply at the question of what this health care legislation is going to cost, but what would have been the costs if things remained progressing at the rate that things had been progressing.
Is there anything that you've seen that maybe other people would consider confusing out there from what you've seen on this legislation?
Well, there's a big gap between what is contained in the legislation and what gets turned into regulation and policy. And the next steps, assuming the reconciliation bill is passed, which it may, of course, may or may not be, but let's say it is, and let's say this legislation is signed into law, we'll then go through a lengthy period in which the legislation is converted into policy, converted into regulation, which will then turn into very simple answers, hopefully, to questions of what does it mean to someone who's a Medicare recipient? What does it mean to someone who's a Medicaid recipient? What does it mean to the commercial insurance payers in the country? And that is where the rubber will effectively hit the road.
Thank you so much. We really appreciate you talking with us tonight. Dr. Jeffrey Gold with UTMC.
Now we want to know, what are your concerns about the health care bill? That is the feedback question we posed earlier tonight. Deny our rights. It's sad that those we voted into office won't even listen to what us Americans have to say. Why don't we get to vote on it if it's supposed to help and improve our lives? And Christie says Obama just worries about what he wants, not the American people. Your feedback is still welcome on Fox Toledo's Facebook or Twitter page, or you can email us.